Hi guys, so today I wanted to talk a little bit about myo exercises. I wanted to start with some of the pre-oral stage exercises and the stage 1 exercises to discuss the different things that we should be looking for when we're completing our exercises and some things that parents can look for to make sure that their children are practicing correctly at home so that they can get the most out of therapy. So I know a lot of kids have a hard time remembering all the different steps, and even when we write it on little post-its, visuals are sometimes much better and more easy. So I wanted to go through a few of them, starting with the lip exercises. So we have our pops, which look like this. With our pops, we're hiding our lips. We want to make sure that we're not rushing through them too quickly, which is something that a lot of our kids do. They'll go. We want to make sure they're not going through them too quickly, but at a good rate. We also have the lip massages. So for the lip massages, we do kind of a sad face. That's a pretty good rate for that, and we want to make sure that they're nice and strong. To start off with some of the tongue exercises, I always like to talk about the basis of the pointy tongue. So the pointy tongue is really important because it is the foundation for which a lot of our exercises are going to build upon. If we don't have pointy tongue, then we're not going to be able to move on in the program. So what we want to look for in the pointy tongue is to make sure the sides of the tongue are tight, not like this, but more like this. We want to make sure that everything's nice and flat. Tip isn't going up, tip isn't going down, anything like that. We want to make sure that we're not having any dental involvement. So not using our teeth to stabilize. We also want to make sure we're not having any labial involvement. So like this. We want to make sure that we're just using our tongue strength and we're able to dissociate it from our other articulators, such as our lips and our teeth. Another thing that's very important for us to know how to do as a foundation for the myo program is spot ID. So for spot ID, we want to make sure that we're going up to our spot, which a lot of the kids have been actually identified with the therapist with a Q-tip to show them exactly where their spot is in their mouth. Now, when we're doing our spot exercise, some things to look for that I've noticed a lot of my patients do is bending back to hit their spot. So it might look like this. Move a little closer. We don't want that because we want them to go directly up to their spot. More like this. Also, another thing that I've noticed that people do with this spot is that they might have it a little bit too far forward, touching their teeth. Too far back. A lot of the times I notice with my kids when I tell them to scoot their spot back, they might go all the way back there. We definitely don't want that. This is a super important exercise because this is where we want our tongue to be resting in the resting position. This is where we want our tongue to be whenever we're swallowing. And this is where we want our tongue to be when we're making specific sounds, such as the T, D, N's, and L's, the S's, and the Z's. So it's really important to have good spot placement. The next exercise I wanted to go over is the side-to-side exercise. So this one is actually another good foundational exercise that I see a lot of the same issues with. So we're going to go like this. Nice and slow. So we want to make sure that we have good dissociation of the lips, the tongue, and the jaw. So we don't want our jaw helping out at all when we're doing this exercise. What does that look like? Like this. I like to tell kiddos to keep their chin still because I'm not really sure if a lot of them know what their jaw is. So I always tell them to keep their chin still. One thing they can do is provide parameter support for themselves as a tactile cue. You can also help out as a parent to try to keep that jaw still. And then eventually the idea is to fade that out. Another thing we want to look for with the side to side is to make sure that they're not sweeping their lips. So again, no labial involvement, no jaw involvement. We want good dissociation of the articulators, good dissociation of the tongue from the jaw and the lips and the teeth. So that's another good one that we can always work on with our kiddos. A lot of our younger kids do that exercise, so it's super helpful to have those visuals for them so that they can get a better grasp on what they should be doing differently. We'll stop there for today, and next week I'll return with some more of the exercises that are a little bit more advanced, such as stage 1 and stage 2. Okay.